Medicines are meant to bring relief to those suffering from one health condition or the other. But when these substances are abused, they can cause serious health issues and even lead to death. On the program this morning, we'll be taking a look at drug abuse, which is rampant among youth in Nigeria. Hello and welcome to Health Business. I'm your host, Oluwatoyin Kolawole.
Drug abuse is fast becoming epidemic across the world, and the ratio in Nigeria is quite alarming, as the proportion of people addicted to prescribed drugs continue to grow daily. Tranquilizers, sedatives, and cough syrup are the leading drugs being abused in Nigeria presently. Different studies have shown that adolescents are the major culprits. Many of these young people abuse pain medications such as tramadol. Pharmacists say the abuse of drugs in this manner can result in a relatively rapid delivery of the drug into the brain and can cause serious side effects.
Now, as far as drug abuse and misuse is concerned, is something that everybody, the pharmacists, as you are referring to us, the parents, guardian, and more importantly, the government, we have to join hands together to fight this menace of drug abuse and misuse. The public, some of them are going into it willingly because they are frustrated and they want something to, to keep them high. And they don't understand that they are in a way destroying themselves.
pharmacists noted that when drugs like tramadol is abused for recreational purposes, it can create a near immediate sense of pleasure and happiness that is often be compared to a morphine high that is unsafe, as the side effects can be seizures that could lead to death.
There is no restriction to access to drugs in Nigeria. Drugs are, products that are supposed to have limited access. And because of that, drug is available. Those drugs that people are supposed to get on prescription are available for them anytime they walk to a drugstore, whether it's an approved one or an unapproved one. So that's number one reason. The second reason is because of this unrestricted access. When people take some drugs and they have seen that they get some feelings from it, especially when we are talking about abuse, they get a form of euphoria, they get high. So the tendency is there that they will always go for it again. Like it's obtainable in codeine containing cough syrup, which is highly abused in our society as of the present.
These professionals explain that it is important for key players in the health sector to constantly increase awareness on the dangers of drug misuse.
It is always important to put some of these things in perspectives. Medicines or drugs, whatever you choose to call them, are not ordinary articles or commodities. They are specialized commodities. That is why most responsible countries place regulation of medicine use within the confines of a central government. In Nigeria today, we have a Fake Drug Act. The Fake Drug Act is very clear in Section 2(1) that the sales of medicines, the sales of drugs is prohibited in some places in Nigeria. One of such places is what you just talked about, hawking. It is actually an offense for anybody to hawk drugs in Nigeria. And this measure is only geared towards public health safety.
But basically, I think we need to continue to create awareness on the danger. And again, because there's criminal tendencies that is attached to it. Remember that cannabis is a drug substance. Alcohol is a drug substance. What is just important there is for us to continue to create awareness and let people know the danger involved.
These professionals believe that unrestricted access to medicines through the open drug and inadequate regulatory enforcement markets have remained the root cause of rampant drug misuse and abuse in the society. They are, however, calling on the federal government to close down all open drug markets in Nigeria. These, they say, will reduce the havoc wrought by drug abuse in the country.
Good afternoon, ma.
Oh, good afternoon.
How you doing?
How are you?
Fine, ma. Thank you, ma.
How may I be of help to you today?
You get Benylin and codeine.
Benylin and codeine.
Benylin with codeine. That cough syrup now.
Who won't take them?
Na me, I dey get one serious cough like that. I don't use all this your cough syrup. They know they work. Just give me that Benylin with codeine. Shina, how much do they sell them again?
Benylin with codeine, you said. Do you have a prescription from the doctor for Benylin with codeine?
This one for myself. Now don't start again. Anytime where a person come in, I go ask for prescription. Just give me the Benylin with codeine. How much?
Okay, explain this cough to me.
I won't take explain cough again. Give you. Give me Benylin with codeine. Now that one they work for. See, I don't even fit talk when as I talk to you. Now that one I don't take before, and the only way till they work for me. Anytime I take them, get how my body they do now. You're the day alright. Where? So all this one really work.
Okay, calm down. Let's talk.
Oh.
In your interest only. In your interest. Do you know this Benylin with codeine you are talking about? If you take it at the normal dose, that may be okay. But many people don't. And at above the normal dose, it's very injurious. How do you take it? Just talk with me. In your interest now. I'm just talking in your own interest.
I didn't take Benylin with codeine again. The one they buy before, I just buy and open and drink. And the one I just pour and small, I will just get that confidence. I go high where.
You see?
So you even know how the thing they beat you. Just
you see?
Just give me this thing.
Yeah, that's good to feel high. But do you know the damage it's doing to you? Let me tell you.
I take this thing before. I take it.
Oh, the more reason we need to talk about it. Have you ever seen your liver before? Have you ever seen your kidneys before? Benylin with codeine overdose can pack up your liver.
Pack up liver, okay.
Can pack up your kidneys. It can arrest the way you breathe, and then you might just suddenly collapse and die.
This is your too many English. I never heard this one before.
Please, my dear, I'm talking to you as a concerned healthcare professional. I'm talking to you as a concerned pharmacist. You see, you have the money. I need the money. I have the product you want, but it's injurious to you. So let us talk. Now, this Benylin with codeine, how long have you been taking? Let's talk.
I don't use them since now. The only thing where they work.
You want to continue taking something that may damage your liver, may collapse your kidney, may stop your breathing suddenly one day, and then you collapse and die. So many harm it can do. Apart from that, socially, it's also not healthy for you. It drains your pocket because that means you have to be buying more and more every time to get the same feeling. Do you want to continue taking it?
Don't be say, I like, see.
Do you want to continue taking it?
Well, now they work for me now.
Do you want to continue it? You want to take something that can kill you?
You get another one for me. Or if you get another one, but all those places where they buy and they tell me all those
let's
things.
Talk. Do you really have cough?
Damn, don't be say you supposed to know how this thing they be now. Don't be say the cough did there, but
you see, you don't even have a cough, so we don't have a cough to worry about. Most cough syrups are not designed to stop cough. Cough is not a disease. Cough is something that is to get out what is making you uncomfortable. So what cough syrups are designed for? To help you cough out. But since you don't even have a cough, let's not go there. Let's talk about how you can stop taking Benylin with codeine. Are you ready to stop?
You get how you go to help me. Just like you talk now, I don't go want me my liver damage. I don't go want me my kidney. I don't want to die early as I did like this. If you guys go help me, I go happy now.
I will really help you because you see, I have a number of years ahead of you, and you need to be healthy and strong and grow up into fulfilling God's plan for your life. So we'll talk about that. You see me, okay? Wait and see me so that we can go in and talk. Dear viewers, here we go again. Benylin with codeine. So many cough syrups with codeine. Products with codeine, they have restricted use. There is recommended dosage. At the recommended dosage, they are generally safe and effective. But once you step out of that boundary and you take more than is recommended, that amounts to drug abuse. Now, unfortunately, with Benylin with codeine, it's very unforgiving if you overuse it because it can damage your liver. It can go for your kidneys. It can give you respiratory collapse. That means that suddenly you just find yourself unable to breathe, and you know what that means? Ultimately, it can lead to death. Apart from all other vices around you, I mean, it could be very socially destabilizing. You spend all your funds on it. It's just not worth abusing. So I want to appeal to you. If you have not started, don't start. If you're already hooked on Benylin with codeine or any product with codeine, you need help. Get help from your pharmacist or your doctor. Talk with them, they will help you.
Well, I think it's peer pressure. When they see their peers doing it and they just want to do it, or sometimes because they want to impress others and big girl, big boy kind of thing. I think the main problem is peer pressure, you know. You see your mates doing other things and then you just want to join them and you want to know how it feels like.
Some like the feeling of being high. You understand? Like maybe take overdose of codeine, overdose of tramadol. Some people like the feelings of, you understand, like being extraordinary, normal.
People abuse drugs for different reasons. I think why young youths actually abuse drugs is based on peer influence, more from friends, and some people abuse drugs to erase depression. Some also abuse drugs to be high. They feel they can be like Van Damme when they take drugs. I don't know if I'm correct, but I mean, that's my own perception about drug abuse.
Yeah, I think young people abuse drugs nowadays because a lot of people is under depression and stress. Because of that, you know, so everybody want to take something to ease their pain. So I think that's the reason why, you know, because if you have something doing, going to your work, coming back, I don't think you have time to use drug, you know, because you have to work tomorrow. But if you don't have a job, you don't have anything to do, so you're free, too much freedom, especially. And a lot of people are depressed, they want to get high and forget, yeah.
Basically, young people abuse drugs because they have easy access to it. And then they don't have the orientation against drugs. I believe that if parents could enlighten children about the problems, the horrors that comes with using drugs, then it will deter them from using it.
Most of the time, young people, they would like to be high. You see, they would like to be high, they wouldn't like to be ordinary or common. Maybe they are behaving normally, but you see them, maybe they want to carry out an action, fighting, quarrel, or to do one thing or the other in the society. They will go on high. If they are not okay or satisfied with their drinks, most of them, they will go on drug.
The reason why I think young people abuse drugs because of lack of parental control and lack of fear of God and no good religion upbringing.
Why the young people in Nigeria are abusing drugs? Because of their carelessness of life, indiscipline of life. Because if it's not carelessness and indiscipline, how can you take something that will destroy you? What are you gaining from taking it? So we elders should continue advise them not to waste their life. Drug abuse is not good.
In a bid to reduce the rate of drug abuse in Nigeria, it is important for key stakeholders in the health sector to constantly increase their awareness about this issue. Next on the lineup is Dr. David Ikudaisi on regenerative medicine.
Hello, welcome to this week's episode of Regenerative Medicine. I'm Dr. David Ikudaisi, and today I'll be talking about how regenerative medicine can be used to address sexual dysfunction in male and female. Regenerative medicine is a game-changing area of medicine with the potential to fully heal damaged tissues, organs, and offering solutions to people who have conditions that today are beyond repair. It happens that God has created us to be able to heal ourselves naturally. Now we have the knowledge to be able to accelerate this healing process. That is where regenerative medicine comes in. For sexual dysfunction, both in male and female, there are many causes. It could be psychological, it could also be physical. Physical conditions would be like, causes would be like things like maybe medical conditions in male, let's say diabetes, heart disease. It could also be being overweight, obesity. In female, it's also common even if they have a kidney condition that could also affect both male and female as well. This psychological part of it as well could be maybe stress, anxiety, maybe previous abuse, and different other reasons. But many patients have tried different things and they're still not getting results, even if their medical condition has been addressed. Now, with help of regenerative medicine, there is another hope of getting results. The way this works is the stem cells or the platelet-rich plasma is being transplanted to the patient intravenously or locally to the reproductive organ. In men, the result is increased stamina and also ability to grow in length and width. In women, the desire is being restored, lubrication, so there's no longer need to worry about pain. Also, they're able to have it in a pleasurable way, because husband and wife should be able to mutually enjoy the process. Regenerative medicine can help to save marriages, save homes, and it does not matter your age. Because you are old does not mean that your marriage should not be as sweet as it was at the beginning of the marriage. This is where platelet-rich plasma therapy or hydro stem cell therapy comes into place. The process are called P-shot for men or O-shot for women. This name was designed by an American physician, and studies shows that has been very helpful for all patients. So if there's anybody watching this and they think because they're, let's say female, they think because they're menopause, they cannot get their life back, well, there is now hope. And those that are men too, if you tried everything, nothing works, remember, regenerative medicine offers solution and hopes for those who have lost hope on their conditions. So this is something to address. I hope I've been able to use this opportunity to educate you on how regenerative medicine can help restore normal sexual function in both male and female. I'm looking forward to see you at the next week episode on regenerative medicine, when we're going to be picking on another medical conditions that can benefit from regenerative medicine. Thank you. I'm Dr. David Ikudaisi, and see you next week.
This morning on Mother and Child, we'll be educating mothers on how to reduce fever in children before getting to the hospital.
A fever is a common sign of illness, but it is not always a bad thing. In fact, a fever is usually a normal response of a child's immune system to a virus or bacterial infection. Most healthy children can tolerate a fever well, and it lasts about 3 to 5 days under normal circumstances. The most common cause of fevers in babies is a viral infection. In some cases, teething can cause a slight increase in body temperature. In younger babies, a fever could be a sign of a serious infection. When your baby's temperature is higher than 38 degrees Celsius, it should be a great concern for you. Here are some home remedies to help reduce high temperature in children. 1. Cold compresses. As soon as your baby develops a fever, the first thing to do is put a cool wet washcloth on your baby's forehead. As the water from the wet washcloth evaporates from the skin, it will draw the fever out and the temperature will come down quickly. 2. Lukewarm bath. A lukewarm bath will help relax a fuzzy baby and help regulate the body temperature. It will even help your baby sleep better, which is needed for faster recovery. Do not use cold water. 3. Breast milk. For babies younger than 6 months old, breast milk is very important. It offers a unique balance of nutrients that strengthens a baby's weak immune system and is tailored to fight a baby's illness. Breast milk is quickly and easily digested. It will even keep a sick baby properly hydrated, which is essential for fast recovery. 4. Use fan. Keep a fan at a low setting and have it circulate the air around the baby rather than blow directly on the baby. If your baby shows other signs or symptoms of illness, such as a cold, cough, vomiting, or diarrhea, consult your doctor immediately. Till next week when we bring another informative topic on mother and child. Bye for now.
This is where we call it a day on health business this morning. We are calling on corporate organization and pharmaceutical company to please place the advert on this program so we can come on air next week. Remember, living healthy is a serious business. My name is Oluwatoyin Kolawole and the program is Health Business. Until I come your way next week, bye for now. Thank you.